Thank you, Adrian and Sarah, for such a great session. It's really exciting to see how much fintech has evolved in the past couple of years, and especially the consequential role that it has played in scaling and distributing relief efforts. It will be interesting to see if our existing payments infrastructure catches up to see any further advancement. But as we wrap for today, I am joined by my colleague, Dan Murphy, who leads our policy work at the Financial Health Network. Dan, first of all, thank you so much for joining me today.
Thank you. It's great to be here, and it's great to be here at the end of such a fantastic day.
Yeah, it's great to have you. I'd love to hear any reflections that you may have on today's sessions. What stood out to you and why?
Yeah, I mean, really too much to cover everything because there were too many fantastic points that were made. But I think one of the things that I kept thinking about, in particular during the equity-based solutions session, was just how much we need to be thinking about the types of incentive structures that we're creating as a society and as, policymakers, financial institutions, really everyone. I think Priya's point that fines and fees are inherently regressive is such an important and powerful one today, whether you're a local government or a financial institution. Another one that I thought was really important was just a lot of the points that were made during the social safety net session around the importance of providing efficient and effective government relief and just the child tax credit as that has expanded. I think in particular, Anina's point that the IRS should maybe have a dual mandate, not only as a revenue collector, but also as a benefits administrator is a critical point and really kind of underscores the opportunity right now for policymakers to reframe their role as supporting financial health and not only as collecting taxes.
Yeah, absolutely. And we heard throughout the day a big thread around the need for building better systems so there can actually be a movement towards financial health for all. So where do you see the biggest opportunities in financial services or for financial services companies that want to be part of this movement?
Yeah, absolutely. I think there were a lot of good touch points on this during the conversations today. I think first and foremost, it has to be said, and I know a number of people said it today, that financial institutions have to advocate for the systemic policy solutions that really will advance financial health the most. I think when we see low wages, we see high healthcare costs, high education costs, it's obvious that these are the real core issues that influence Americans' financial health. But second, and I think Jen made a really important point during her opening remarks today, is just that there's a real opportunity for partnerships for financial institutions to work with policymakers. And as Nina said today during the social safety net session, to work with even volunteer groups to think about how to best connect folks to the types of benefits they're eligible for. And as the child tax credit gets rolled out, I think that's something we really need to think more about.
Absolutely. Oh, sorry, I'll let you finish.
No, I was just going to say, and finally, I think, Jen talked too about how, a lot of what we're talking about here are applying tourniquets, but that really is incredibly important, in particular for financial institutions. I think for fintechs in particular, as Adrian was just saying, we've seen a long moment where there's sort of been an assumption that, a financial health mission means financial health impact. And we need to see the proof now. We need to see the impact. We need to see institutions driving for results, measuring their own results, and really looking for the proof.
Yeah, you're absolutely right. We're seeing the commitments come in. We're seeing the partnerships starting to really flourish. So we'll see what happens. But thank you so much for your remarks, Dan. That brings us to our conclusion of today's sessions, Zooming Out Systems Change. And before we wrap, I want to encourage you to join us tomorrow at 1 p.m. Central Time, where we'll focus on the people and specifically on how the pandemic and economic downturn have impacted women in the United States. We will also hear from industry leaders who are focused on advancing financial health for their customers, employees, and communities against this shifting landscape. And we will conclude with our Financial Health Visionary Award. This is going to be recognizing individuals who have shown unparalleled leadership and encourage the next generation of leaders to innovate. Just finally, we would love to hear your feedback and see how today's sessions went. So we will be seeing a poll coming here shortly. Just share with us what was the most valuable part of today, and we hope to see you tomorrow again at 1 p.m.